A landmark new study is drawing a link between teenage pregnancy and a heightened risk of dying young. This study looked at data between 1991 and 2021. Researchers found that teenagers in Ontario who experienced a pregnancy had a 50% higher chance of premature death by the age of 31. The risk level greatly rose for those who had 2 or more pregnancies before they turned 16. Researchers looked at the data of roughly 2.2 million teens for this study. There is a lot to go through. So with that, Dr. Eyal Cohen is a physician and senior researcher with SickKids Hospital, joins us now with more. Dr. Cohen, first of all, thank you for joining us. When you look at the headline, there is so much more to take apart. So let's look at what that data really is. Dr. Cohen, 2.2, that is no small figure. This is an extensive study. So why look at this, first of all?
So first of all, thank you, Melanie, for having me here today. I think we all recognize that teenage pregnancy is an important issue, both in terms of the fact that it is an event that for many individuals is an unintended event that we can think a little bit about how to prevent, and also is an event that the individuals who experience teen pregnancy need support over their life course. So our team thought it was very important to understand to what extent young teenagers who have a pregnancy are at risk of long-term effects from it. And in particular, this study focused on mortality.
The numbers are staggering, as we noted just in that intro there. And, the chances of, 1 pregnancy versus 2, and that almost doubles. What kinds of factors are we looking at when it comes to early death?
So in terms of what is leading to early death in these young individuals, the majority of deaths in young people, what we call premature mortality, is due to injuries. So things like suicide, things like assault, car accidents, those are the majority of causes of death in people in this age group.
You mentioned earlier, Dr. Cohen, that there are some gaps when it comes to medical care. So when you look at these figures, where are those gaps and how can they be filled?
So I don't tend to think of the pregnancy in and of itself as the only risk for mortality in these young individuals. We know that there is an association between teenage pregnancy and adverse childhood experiences, things like exposure to violence, exposure to family instability, exposure to extreme poverty. And all of those factors, both before and after the pregnancy, are the likely reason why these individuals are at increased risk of premature mortality. So the more we can do as a society to prevent these adverse childhood experiences and support individuals who experience them to thrive, the more we can do to attenuate, to decrease the risk of some of what we described in this study.
Doctor, just looking back at the numbers again, the risk significantly jumps for those who had a second child as a teenager. What is the connection there and why is that?
So we found that individuals who had earlier pregnancies, so for instance, under age 16, were also at particularly increased risk. So if an individual has a teenage pregnancy at a particularly young age, they obviously have more years to have a second pregnancy after that. And I think it's the cumulative aspects, again, of those root causes of what leads to particularly unintended teenage pregnancy that really is what explains what we're seeing in the data.
And there is a lot of data here, and I encourage our viewers to check out our website for more on this. But when you look at these statistics, there is a lot hypothetically that should be done and can be done, but then it comes down to the resources that are available to make it happen. So will there be eyes on this report and what can be done moving forward?
Yeah, so I think there's 2 major things. The first thing is what we can do to prevent unintended teenage pregnancy. And a lot of that is the whole concept of how, and I think the study underscores shortcomings in our system to educate, guide, support young individuals at that phase of their life. I'm very happy to see that the federal government in the Universal Pharmacare program In late February, introduced universal contraception, access to universal contraception as one of the first kind of pillars of that program. And then the second thing is for individuals who do experience pregnancy, we know that the development and access of teams, of multidisciplinary teams of healthcare providers who can attend to the physical, mental health, psychosocial needs of these young individuals, including ways of providing support for them to attain their education, complete vocational training, and even support them in early life parenting can be extremely beneficial. And we have programs like that in many places. For instance, at the hospital I work at Sick Kids in Toronto, we have a young families program and a young perinatal program that are specifically designed to address those issues. And they really focus on strengths-based approaches that really respects the autonomy and the resiliency of young individuals who experience pregnancy.
A very important report. Thank you so much for your work. Dr. Cohen, appreciate your time today. Thank you.
Thank you for having me. Have a wonderful day.
You too.